Yesterday, the American Academy of Child and Adolescent Psychiatry tweeted this Venn diagram comparing psychologists to child and adolescent psychiatrists. It has since been deleted, but I want to talk about why this tweet was so problematic as a licensed clinical psychologist. So the first thing I'm going to address is this 3 to 5 years of graduate psychology training. After one gets a bachelor's degree, so a 4-year degree, if they go straight into a doctoral program, on average it takes 4 to 6 years to get a PsyD or 5 to 7 years to get a PhD. Nowhere do I know of where someone can get a doctorate degree in psychology in 3 years. Next, the 1 year of doctoral internship is semi-correct, so we have a 1-year pre-doctoral internship, which is our last year of graduate training before we are awarded our doctorate degree. So this is 2,000 hours of clinical training. What this Venn diagram missed is that in most states in the United States, you also have to complete a postdoctoral fellowship before you can get licensed. And depending on the state and depending on the fellowship, this is an additional 1 to 2 years of clinical training. Now to the last bullet point, which is probably the worst of them all. So this Venn diagram claims that psychologists only have 1 year, which they equate to 1,920 hours of total patient care throughout training. This is absolutely false. Your pre-doctoral internship is 2,000 hours of clinical training. So that is just the last year of the doctorate program. If you get a fellowship, if it's 1 year, it's another 2,000 plus hours. I accrued 2,080 hours on my fellowship. If you do 2 years, obviously that's more. And then they excluded all the clinical training that we get during our doctorate program. So for me specifically, I accrued an additional approximately 4,000 hours throughout my 6 years in graduate school of direct supervised clinical training, equating to about 8,000 hours of direct supervised clinical training before I was eligible to get licensed. This Venn diagram also leaves out some key differences, the main one being psychiatrists can prescribe psychotropic medications, where psychologists in general can't unless you live in specific states, there's only a couple of them, and get extra training. Further, it leaves out the fact that psychologists are highly trained in psychological assessment, where psychiatrists, to my knowledge, aren't. They're not trained on those standardized tests like the MMPI, Woodcock-Johnson, WACE, etc. As for similarities, although psychiatrists and psychologists are both trained to provide psychotherapy, at least in the United States, it's very rare to find a psychiatrist that does provide psychotherapy on a regular basis. Most often they do the medication management and work with a psychologist or another mental health professional that provides therapy to provide comprehensive care to the individual. At the end of the day, the most important thing is we work together to provide best care for our patients.